Lip tie releases piss me off. It's pretty common for a patient to go to a so-called TMJ dentist or a holistic dentist, the kind of dentist that offers ALF, AGA, DNA, homeoblock. You get the picture, right? You go to a dentist like that, they're going to sit you down, they're going to try to sell you the works. An AGA, 20 grand. A tongue tie release, another couple grand. A bunch of myofunctional therapy at $200 a session. Prolotherapy up the ass, you name it, okay? And then on top of all that, they're going to spice up the deal by, oh, you're going to do a tongue tie release? Let's do a lip tie release as well, okay? And a buccal tie release as well. And you figure, hey, I already am paying 20 grand for the AGA and all this other crap. They're already going to do my tongue tie release. I'm already in the chair numb. Might as well let them hit my lips too. The only problem with that is lip tie releases suck. They come with problems. Number one, is it really necessary? I mean, is your lip really tied? Says who? So you flap your lip a little bit, you see a little bit of a frenum there, but is that really impacting your function? I mean, the holistic TMJ dentists, what an absurd name, right? A TMJ dentist. They're never orthodontists, by the way. Take note, TMJ dentists are always general dentists who just spice up their brand a little bit with the TMJ or the biological dentist label. You can identify these people. Number one, they're not orthodontists. Number two, they call themselves TMJ dentists. Number three, they always offer tooth-borne expanders. It's almost a meme, right? Oh, and number four, their treatment protocols and plans are always double the cost of like a legit MSE plus orthodontics plus piezo surgical assist price, which comes in, let's say under 15, and the TMJ dentist is always going to come in closer to 20 to 30, which is another absurdity. But I digress. Getting back to the lip tie release. Okay? What are my problems with it? Number one, is it really necessary? Highly unlikely. They sell you on this idea that the lip tie is holding your maxilla back and is preventing your maxilla from growing forward and allowing the epigenetic expander to grow your maxilla. The lip tie release is preventing that from happening. Okay, first of all, that thing is just moved. The expander is just moving teeth. Second of all, so the lip tie is what's causing my maxilla to be recessed, and if I cut that, my maxilla is going to all of a sudden spring forward with the tooth-borne expander? Sure. Okay. Second, so it's not. Is it really necessary? Probably not. Number two, it hurts like a bitch. But if it was worth it, well, we can deal with a little pain. MSE is painful. Tongue tie releases are painful. Braces and having metal in your mouth is painful. The lip tie release is painful, and that's a negative to it. It hurts real bad, actually. It feels like it's like a throbbing, bruising pain that sits right here for the better part of 2 weeks, I would say. Tongue tie releases are also very painful. Number three, it messes up your smile, or it can, okay? If the lip tie release is not perfectly even, then what ends up happening is one side of your lip, your upper lip, has more mobility than the other, and that can fuck up your smile. It can even give you the appearance of having a maxillary cant. Number four, lip tie releases leave a nasty scar. Okay, now the scar is pretty much invisible unless you peel your upper lip back. But when you do peel the upper lip back, it looks straight up like you got lightsabered across your upper lip, and it never goes away. The scar tissue is brutal, and it's grotesque, if you ever look at it. But it's there. I mean, and it's only just as far as your upper lip hides it. Next downside, lip tie releases are dangerous, okay? There's blood vessels in there, tucked up in here. I heard a story of a patient, someone who actually consulted with me earlier this year, who told me he almost died from his lip tie release. He pretty much got hit with the laser, the dentist laser pen, and started bleeding. And the bleeding didn't stop while he was there in the chair. All of a sudden, everyone was like, whoa, 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 the bleeding's getting worse. This dude almost bled out in the dentist's chair after his lip tie release and ended up having to get rushed to the hospital to prevent himself from bleeding out. So what are we doing here with these lip tie releases? I understand it's a sexy sell, and you might as well tack it on top of the package, the $25,000 TMJ package, but we should all be real careful before agreeing to something like a lip tie release. Tongue tie release, different story. Lip tie release, think twice about it. I'll leave you with that. Peace out.